So we're the can uh we're the cancer team, and today we're going to be talking about cancer. Oh, next slide. Yeah. So for table of contents, we're going to start off talking about the intro, basically what overview of cancer, causes of cancer, and the types of professions cancer has. Second, we're going to be talking about the different types of cancer and the different types of cancer stages for each type of cancer. Third, we're going to talk about the diagnosis and prognosis of cancer. And finally, we're going to be talking about cancer research and ongoing research. That's pretty interesting. Next slide. All right, what is cancer? Cancer is when you have mutated cells that divide uncontrollably and affect other parts of your body.
Let's have a deep dive into cancer. All cancer begins in cells, and your cells divide and make more copies of themselves as part of their normal function. But sometimes they get changes, which are mutations that cause them to keep making more of themselves when they shouldn't. Damaged cells dividing uncontrollably create masses or tumors of tissue that eventually keep your organs from working properly. A little fun fact is that our bodies are made out of more than 100 million cells, which is 14 zeros. What are mutated cells? Usually, we have just the right number of each type of cell. This is because cells produce signals to control how much and how often cells divide. If these signals are faulty or missing, cells might start to grow and multiply too much to form a lump called tumor. Mutations in cells can happen by chance when a cell is dividing. Some mutations mean that the cell is no longer understanding its instructions and can grow out of control. There has to be about 6 different mutations before a normal cell turns into a cancer cell, depending on different cancer types. So how do these cells become mutated? Cancer cells have gene mutations that turn the cell from a normal cell into a cancer cell. These genes may be inherited, developed over time, or developed when we are using something that damages our bodies, like cigarettes, alcohol, or ultraviolet radiation from the sun, and many more. Many people think that tumors are simply just a clump of cancer cells. Instead, they are abnormal organs composed of multiple cell types. Some aspects of tumor development resembles processes seen in developing organs, while others are more akin to tissue remodeling. So, to give a general reason of why one can develop cancer, there are two aspects to take account: genetic and environmental factors. Proto-oncogenes are usually helpful as the aid of cell growth and division. However, when mutated, they are now oncogenes. This oncogene acts as the gas pedal of the car. When you press the gas pedal, it increases the speed of the car and sometimes to an unnecessary extent. Similarly, this gene allows the cell to grow and multiply at an unnecessary speed, causing cancer. On the other hand, tumor suppressor genes are used to control cell growth and division, almost like the brake pedal of a car used to control speed. When the gene is mutated, an example of this being pathogenic variants, which are variations in a person's gene that lead to disease, cells can grow without stop.
Some external factors that contribute to developing cancer is smoking, viruses, cancer-causing chemicals such as carcinogens, obesity, and radiation. And radiation can come from either the X-ray or the sun. So to talk about how to prevent cancer, um, you can stop using tobacco, and this includes cigarettes, chewed tobacco, and electronic versions of these items. So smoking can cause lung cancer, mouth, throat, voice box, pancreas, bladder, cervix, and kidney cancer, and chewed tobacco can lead to mouth, throat, and pancreas cancer. Second, you should maintain a healthy diet because an excessive consumption of alcohol can lead to breast, colon, lung, kidney, and liver cancer. But by eating the right amount of nutrition, like healthy fats and fiber, this keeps you healthy. But even though this doesn't directly aid with preventing cancer, it does lead to the next topic, which is maintaining a healthy weight. And it is recommended that you do hard or moderate aerobic activity for 75 to 150 minutes weekly and at least 30 minutes daily. You should also protect yourself from the sun, especially during midday between 10 to 4 when the sun's rays are strongest. You should stay in the shade, cover your skin, wear sunglasses or head coverings like hats, use sunscreen, and not using tanning beds because tanning beds can have the same effect as the sun. You should also get vaccinated because by protecting yourself against certain infections, you can protect yourself from some cancers that are caused by these infections. And an example of this would be hepatitis B, which increases your chance of getting liver cancer. And finally, you should get regular checkups to make sure your body is healthy because the earlier you detect cancer, the easier it is to get rid of it.
All right, so for oncologist is a doctor who provides medical care for a person diagnosed with cancer. An oncologist is sometimes also called a cancer specialist. And there's three types of major oncologists. First is medical oncologists who conduct chemotherapy, immunotherapy, and targeted therapy. Second, there's radiation oncologists who conduct radiation therapy. Third, you have surgical oncologists who conduct surgery, including biopsies. So the main job or role of oncologists is to recommend tests to determine if a person has cancer, explain the cancer diagnosis and treatment options, while still delivering quality and compassionate care, and helping patients manage symptoms and side effects. So the care team, which includes a variety of other health care work professionals such as pathologists, radiologists, nurses, social workers, and pharmacists, and more. All right, so we're going to explain different types of cancer. So for today, we're going to be explaining three different types of cancer: breast cancer, skin cancer, and lung cancer.
So here there are two pie charts, and one is for females and one is for males. So it basically talks about the common types of cancers each gender gets. So for females, on the left side, the most common is breast cancer with 28,961 patients. That's roughly 32%. Following by lung cancer with 10,647. That's 12%. And lastly, colon or rectum cancer with 8,697 patients. That's roughly 10%. As for the males, prostate cancer is 31,120 patients. That's 34%, leading by lung cancer with 12,669. That's 14%. And lastly, colon rectum cancer with 8,772 patients with 10%.
So to talk about breast cancer is the second most common cancer in women following skin cancer, and it can begin in either the lobules, ducts, nipples, areola, stroma, or lymph and blood vessels. The most common form of breast cancer starts in the ducts, and when it starts in the ducts, it is called ductal cancer. So breast cancer can spread through the blood or the lymph system. And for those of you who don't know what the lymph system is, it is part of the immune system and is made up of something called lymph nodes. And that's a little diagram on the bottom right. And lymph nodes are small bean-shaped glands that also contain vessels and ducts. These vessels and ducts contain body tissue, byproducts, waste, and immune cells. Now, once these cancer cells infiltrate the lymph system, particularly the vessels, they tend to go spread to other lymph nodes found in the armpit, found in the breastbone, and found in the collarbones. And when these cancer cells reach the lymph nodes, there is an increased chance for the cells to metastasize, which is another word for spread, and thus develop tumors. So there are 5 stages of breast cancer. Stage 0 is known as carcinoma in situ, and carcinoma means cancer, and in situ means in its original place, so that those in this stage have cancerous cells, but they haven't spread anywhere yet. And then in stage 1, the cancer is non-invasive, meaning that it hasn't spread to other parts of the body. But in stage 1, it is invasive, and it is spread to some lymph nodes. And in stage 3, there can be tumors in the breast. In stage 4, it becomes much more serious, and it's still invasive, and this time the cancer can spread to other organs and other parts of the body, like the liver and the brain. So these stages are diagnosed through a process called T&M, where doctors look at the T, the tumor size, N, the number of nearby lymph nodes that have been infected, and M, how much or little the cancer has metastasized. So to treat these, there are a couple ways that doctors can go about. There's surgery, where doctors can cut out the cancer or the tumor. There's chemotherapy, where doctors can prescribe medicines to shrink or kill the cancer cells, or use IVs to administer these medicines. There's hormonal therapy, where medicines can be used to block out hormones that attach to the cancer cells receptors so they can't grow. And in this case, the hormone would be estrogen. And there's also biological therapy, which helps the immune system fight cancer cells and control the side effects from other treatments. And then there's radiation therapy, where high energy rays, like X-rays, are used to kill the cancers.
All right, skin cancer. Skin cancer is the most common type of cancer in the United States. Skin is the largest organ on your body, as it covers your entire body. Skin has multiple layers, and skin cancer starts out in the outermost layer. Most of the time, skin cancer is curable, but treatments can be expensive and they can have an everlasting scar. Skin cancer causes the most deaths when it starts out in the melanocytes, which, because the cells are deep in your skin, leading to more cancer cells spreading through the body. Some causes of skin cancer is so the main cause of skin cancer is too much exposure to UV or ultraviolet rays, which can come from the sun, tanning beds, or sun lamps. You may not notice much of a difference after being exposed for a short time, but UV rays can cause sunburn, and over time the UV damage piles up, leading to changes in skin texture, which sometimes can cause cancer. So for prevention, the best way to prevent skin cancer is not being exposed to UV rays. While it's not known if sunscreen or protective clothing prevents skin cancer completely, skin experts suggest to wear sunscreen, not staying out when the sun is the strongest, and wearing long sleeves, long pants, hats, or sunglasses to prevent sunburn and lessen the amount of UV rays damaging your skin. Other factors are smoking, being overweight, and not getting enough exercise. There are researchers who are still figuring out more effective ways to prevent skin cancer. Once skin cancer is detected, a CT scan, X-ray, PT scan, ultrasound exam, eye exam, and lymph node biopsy can find out if it has spread to other organs. So for treatments to skin cancer are surgery, radiation therapy, chemotherapy, photodynamic therapy, immunotherapy, targeted therapy, chemical peel, and drug therapy.
So lung cancer is the third most common cancer in the US. It is a disease caused by uncontrolled cell division in your lungs. Lung cancer is a name for cancers that start in your lungs. It is usually in airways like bronchi or bronchioles or small air sacs called alveoli. Cancers that start in other places and move to your lungs are usually named for where they start. Many will refer to this as metastatic cancer. What are the different types of lung cancer? There are many cancers that affect the lungs, but we usually use the term lung cancer for two main kinds, non-small cell lung cancer and small cell lung cancer. Non-small cell lung cancer, also known as NSCLC, is the most common type of lung cancer. It accounts for over 80% of lung cancer cases. Common types include adenocarcinoma and squamous cell carcinoma. Small cell cancer, also known as SCLC, grows more quickly and is harder to treat than non-small cell lung cancer. It is often found as a relatively small lung tumor that already spread to other parts of your body. Specific types of small cell lung cancer include small cell carcinoma, also called oat cell carcinoma, and combined small cell carcinoma.
So, for lung cancer, the possible causes can be smoking, secondhand smoke, exposure radon gas, and family history of lung cancer. Why especially smoking is because doctors believe that when you smoke, the lung cancer can like damage the cells that line the lungs. When you inhale the smoke, which is full of like cancer-causing substances called carcinogens, it changes the lung tissue almost immediately. At first, your body may be able to repair it, but with like excessive amount of smoking, it would be hard for your normal cells to line your lungs, and it will increasingly damage them. And over time, these damages can cause the cells to act abnormally, and eventually cancer may develop. So the symptoms can be coughing, shortness of breath, chest pain, and headaches. To prevent that from happening, don't smoke, stay away from smoking, test home for radons, eat more fruits and vegetables, and exercise. And as for the treatments, it's a lot similar to breast cancer and skin cancer. So you can do surgery, chemotherapy, radiation therapy, targeted therapy, or a combination of all these treatments.
All right, so next we're gonna be talking about diagnosis and prognosis of cancer.
So what exactly is diagnosis and prognosis? To be brief, diagnosis means to determine the cause of disease based on symptoms and signs shown. So in order to determine the diagnosis, biopsies are commonly used on patients. Biopsies mean that they're like a type of procedure that where they remove a living tissue or cell in your body and they examine them in the laboratory to find what exactly is wrong with your body. As for prognosis, it is prediction of how the disease will affect the patient. Since each cancer has different effects, there are factors to determine your prognosis. This includes the type of cancers and where it is in your body. What stage your cancer is. So if you check in with your doctor earlier, it would be an early stage. But if you wait until symptoms are visible and they're unbearable, those can be late stages. It can also be the cancer's grade, which means how the cells are like. So usually in normal looking cells, the edges of the cells are round and look healthy. But in cancer cells, the edges are pointed and there's no smooth outline. It could also be the age and how healthy you were before cancer and how you respond to the treatment. Yeah, and this is just an image showing how like normal looking cells look like and how cancer cells look like. And as you can see, the edges are very smooth for the normal cells, and for the cancerous cells, they're very edgy and rough.
All right, finally, we're gonna be talking about cancer research.
So to start off, there is a cure for acute lymphoblastic leukemia, also known as ALL, and this is the most common form of childhood cancer. And this CAR T therapy was approved in 2017 as an effective solution to cure ALL. So the first child to be cured with this was Emily Whitehead, and she had already relapsed twice with ALL, and she'd already tried chemotherapy, but that didn't work. So her options of getting treated for cancer was limited. So before I get into what CAR T therapy is, I'm going to explain what T cells are. And T cells are a type of white blood cell that fight infections. They each have receptors that recognize antigens, which are proteins that mark a cell, and this can cause the immune system to attack cells with foreign or abnormal antigens, such as those found on cancer cells. So now, through a process called leukapheresis, the T cells are extracted out of a patient's body and then they are brought to a lab. Once they're brought to the lab, scientists inject the gene that codes for a protein called chimeric antigen receptor, CAR, and this is made to attach to the ALL cancer cell and then kill it. These cells are then grown for several weeks to provide a sufficient amount to the patient, and then they are injected back to the patient, and usually chemotherapy is recommended while the CAR T cells are working to improve effectiveness. Once the CAR T cells are able to bind with the ALL cancer cells, they attach to the cancer and they're able to kill the cancer or perform apoptosis, which is also known as cell death. Some side effects include cytokine release syndrome, CRS, which is when cytokines, a chemical, are released into the blood. And since this is a foreign substance, the immune system continuously attacks it, causing it to go into overdrive. And this causes the patient to have high fevers, chills, breathing troubles, nausea, diarrhea, dizziness, headaches, a rapid heartbeat, fatigue, and even muscle or joint pain.
So other than CAR T, there's also an ongoing cancer research called BNCT. Now, what is BNCT? BNCT stands for Boron Neutron Cancer Therapy. It is a next-generation theranostic radiopharmaceutical research. BNCT is a type of nuclear medicine. It is a type of radiotherapy for testing locally invasive malignant tumors such as primary brain tumors, recurrent cancers in the head and neck region, and cutaneous and extracutaneous melanomas. BNCT is the research of radiation therapy to deliver a tumoricidal radiation dose to a tumor while minimizing exposure of normal organs or, most importantly, the surroundings of the tumor. This is also the principle of all radiation therapy. BNCT is based on the nuclear capture and fission reactions that occur when non-radioactive boron is irradiated with slow thermal neutrons with the appropriate energy to trigger the reaction. Now that we know what it is, what does BNCT do? BNCT provides an alternative and unique approach by delivering charged particles at the intracellular level directly inside the tumor. It biologically and physically targets tumors via a binary system that consists of two separate components to achieve its therapeutic effect. BNCT infuses a patient with boron and is delivered to tumor cells and normal cells. When a neutron beam is fired into a cell harboring a high concentration of boron, the reaction occurs and the boron-containing cell will be damaged.
Thank you.
Thank you guys. That was a really informative presentation. It was super interesting. And I love how you guys talked about like preventative measures that you could take. Like Kaz and Elaine, when you guys mentioned like not smoking. So like just making sure that everyone knows those risk factors, right? Because cancer is a super like more common thing, and a lot of people are diagnosed with it per year. And especially how you guys talked about making sure you know when the stages of cancer are. It's like because it metastasizes, like knowing when you have cancer early on is better than knowing later on. And I also liked how you guys talked about like oncology and jobs in oncology. And of course, you have like more specialized fields like pediatric oncology, and like gynecologic oncology, just for like different parts of the body. And it's also really important to just have specialists who can provide care and support for people who like have certain types of of cancer. Yeah, thank you. That was just a really informative presentation. And if anyone else has questions, you can always feel free to send them in the chat or email, and we can connect you with resources.